Welcome to the PAH Today National Broadcast Series. My name is Dr. Lana Melendres-Groves, and I'm the Medical Director for the University of New Mexico Pulmonary Hypertension Program. It's my pleasure to guide all of you through the 4 essential elements of your PAH care during this broadcast. This presentation is sponsored by and made on behalf of United Therapeutics. Healthcare professional speakers are compensated by UT. Not all medications are appropriate for all patients. Speak with your healthcare professional to determine the right treatment plan for you. I think we have a really fun broadcast today because we're going to talk about how we might be able to gain some new insights when you're working with your PAH care team. There are 4 essential elements of a care plan that we can put in motion. First, we're going to talk about just seeing a PAH specialist. Next, we're going to move into how regular risk assessments are meaningful and essential. Third, we'll talk about setting a goal. This is all about knowing your options. And fourth, we're really going to round it out with how you can take care of yourself. First, let's talk about this PAH specialist and how seeing one when we're talking about a rare disease like pulmonary arterial hypertension can be so essential. A PAH specialist is someone that you will be partnering with to reach your goals. You may ask, why do I need a specialist in PAH? And it's a great question because in reality, these are individuals who tend to have specialized training and experience when it comes to pulmonary arterial hypertension. They have insights into all of the types of medications used for PAH. They have expertise in the tools and tests that are required to monitor how you're doing and your disease. And last, they often have access to research as well as other clinical resources that will help you in your treatment goals. This is an individual that will work with you, and as your disease evolves, will be able to change and modify your care plan to evolve as well. It's really important when you see this specialist that you keep it real. We always say transparency is the most important thing that we can have, and trust between the provider and the patient. You should feel free to ask questions. Some of the questions that you might consider are you changing what you do every day to avoid symptoms? When was the last time that you felt, in quotes, normal? Or how do your daily activities compare to what you want them to be? Those are things that you should ask yourself so that when you are with your specialist, they have the opportunity to be able to respond to those questions and give you insights into what might be going on. Ways that you can do that is not just ask the question, but then track those symptoms and how they impact your daily activities. You need to really be open to how you feel and any changes that might be going on. And I know that at times that might be scary, but in reality, speaking about them brings them to the surface so that they can be dealt with. This is how you can sort of understand what is going on and how that can then lead to an action plan. Your specialist is going to work hard to understand you. And every person with PAH may need something slightly different. So this is where a specialist can work with you to set the goals for your care, and then you build a treatment plan around those goals. And adjustments can be made along the way. You may start in one place, and as you move through time, you may need to change that. That brings us to our second section. This is going to be talking about how regular risk assessments are essential to evaluating how our patient is doing and trying to predict their prognosis over the next 5 years. If you've been part of some of our prior broadcasts, first off, if you haven't, don't worry about it. They are available. But if you have, you probably have heard me talk about risk status a number of times. And I want to bring it up again because in terms of something key to your care, this is one of them. This is information that has come from research and data from thousands of PAH patients across the world and helped us to create a big picture for each individual patient. It's based off of not just tests that we do, but also the symptoms that our patients feel. It can help predict the course of an individual person's unique PAH. Specifically, we're looking at life expectancy sort of over the next 5 years when we are calculating someone's risk status. This is also the place where someone's risk status may indicate that an adjustment to their treatment regimen would be appropriate, specifically if they haven't gotten to a low risk status. So I know that there's a bar on the side of my slide, and I want you to take a look at it because high risk in the red zone, intermediate risk, kind of that yellow and orange zone, and then low risk is the green zone. And low risk is what we're shooting for every patient, which indicates that their prognosis over the next 5 years is improved. Next, what's even included in this risk assessment? Well, as I said, specific tests such as blood tests like BMP and NT-proBNP. This helps us to evaluate for possible strain on the right side of the heart. Also, exercise tests or our 6-minute walk distance. And I know that some of you, as always, may be going and groaning in the background because 6-minute walk tests are not my patient's favorite thing to do, but they're tremendously helpful in understanding how someone's exercise capacity may be affected, what their oxygen does, what their vital signs such as heart rate and blood pressure do. But additionally, aside from the tests that we have you do, functional class is about how you feel. And this is where the trust and transparency with your provider is so key because we're trying to evaluate and assess what your functional class is. This information, as well as potentially other tests, are then put into a risk calculator, and we're able to have a generated risk status for each of our patients. If you don't know your risk status, it's okay to ask. I recommend that you ask because this is something that you're able to follow along with your provider over time. Now we're going to move into our next section, which is setting a goal. We can only set goals if we know what those options are for us. So we're going to talk about some of those options and how that goal setting may come about. In order to do that, I think it's important to talk about what PAH looks like in terms of the blood vessels. Pulmonary arterial hypertension is a disease that impacts the blood vessels of the lungs, the pulmonary arteries and arterioles. And in PAH, we find that those blood vessels start to become narrowed and thickened. And that makes it more difficult to get blood flowing through narrowed blood vessels. The result of it is that the pressures go up and the strain on the right side of the heart increases. In terms of how it may make you feel, usually individuals may describe things like shortness of breath or increased tiredness. Over time, this extra work of the right side of the heart leads to ongoing strain and can then lead to heart failure. In individuals that do not have PAH, the blood vessels stay thin, narrow. That narrowing is not there. You have normal blood pressures and normal flow of the blood, and so the right side of the heart feels happy and doesn't have to work excessively hard. The reason that this occurs in the blood vessels is because of an imbalance in the body's own production of natural substances. And unfortunately, at this point in time, we don't have a specific test to be able to figure out which of someone's substances isn't being produced enough of or maybe too much of. And because of that, we have found through studies that patients often benefit from either 2 or more medications to improve their outcomes. So what we look at is our patient, their needs, their risk status, and then based off of that, a determination of what medications might be most appropriate for them. I want to talk a little bit about the medications and the different pathways, because those substances that become imbalanced in PAH are where we direct our medications. We have the endothelin pathway, the nitric oxide pathway, the activin signaling pathway, and the prostacyclin pathway. Each of these pathways and medications address a different need for our patient. In the endothelin pathway, patients with PAH produce too much endothelin. And this is where providing a medication to try and prevent that and rebalance is important. Other patients may have an imbalance in their nitric oxide pathway, and we use specific medications to rebalance so that we're able to prevent the narrowing of those blood vessels. The activin signaling pathway is one of our newer pathways that has become established as an imbalance in patients with PAH. And through therapy, we may be able to rebalance that pathway. The last pathway that I want to focus a little more time on is the prostacyclin pathway. And the reason that I'm going to spend a bit more time is simply because this is our longest standing pathway, but it also we have different ways of being able to deliver the medications. Some patients may benefit from a pill form of a prostacyclin. Others may be a pump form, and still others may be an inhaled form of the medication. We actually know that the inhaled formulations that go directly to the lungs are the fastest growing way to take a prostacyclin class medication. I really want to make sure that there's an understanding that this is a substance that the patient with PAH's body stops to produce enough of. And what we're trying to do with our prostacyclin therapies is to give back the body something that it's not producing enough of and rebalance it. Often, the treatment guidelines are recommending addition of a prostacyclin class medication when patients haven't achieved that low risk status, or maybe they haven't achieved the low risk status in an appropriate time frame. So this would be opportunities to talk to your expert about which medications might be most appropriate for you. I want to spend a little bit of time on some of the things that the prostacyclin class medications have shown to improve when it comes to PAH. The first one I'm going to focus on is going to be about symptoms in pulmonary arterial hypertension patients. And the reason I focus on this first is because I want my patients to feel symptomatically better. We've seen that through our studies and our research that often patients utilizing the prostacyclin medications can have improvements of their symptoms. Additionally, we have seen that there is the potential to slow the progression of someone's PAH. One of the other aspects, and I bring it up because we've talked about 6-minute walk tests, and we utilize the 6-minute walk test to try and understand if our patients may be responding the way we would like to certain therapies or maybe changes in therapies. The prostacyclin class medications have shown that patients have improved distances in their walk tests when in our clinical trials on prostacyclin therapy. And then our last is going to be actual reduction of the blood pressure within the blood vessels of the lungs. So those are some of the expectations when starting a prostacyclin medication. But it is really important to also talk about the potential of certain side effects that come from the prostacyclin class. Because we are dilating blood vessels with these medications, it often causes symptoms such as headaches, maybe some of the belly issues like diarrhea or nausea, sometimes muscle achiness or pain. And these are things that I actually, instead of calling side effects, I often call expectations of the medications. You may not experience all of these, but it's important to talk to your specialist about them so that you have opportunities to try to either prevent those side effects or if you do experience them, ways that you can lessen that effect. So what questions should you ask when you're talking about a PAH medication? We talked earlier about questions that you might be asking yourself when you're preparing to see your specialist. Well, this is a situation where preparing questions that you can ask your specialist becomes important. Talking about, is there an opportunity to improve your risk status? Is it time to add or try a different medication or adjust the dose of a medication? Or simply just asking, is there anything that I can do to make me feel better than I currently feel? All of these questions may be pertinent to you. There may be many, many others. So jot them down. Make sure to ask them. Spend that time with your provider face to face to be able to get the information that you need for your journey through PAH. Now we're getting to something that for me is absolutely essential. And I know I've said all four of these are. Often the first three, that's partnering with your specialist. I like to give opportunities for my patients to be able to improve their own self-care and their daily habits, because in reality, there's so much that you can do when you're on your own that can improve how you feel and long-term how you do in this disease. So this is all about self-care, healthy daily habits, and how they can really be essential in your long-term outcomes. Your treatment plans are often thinking about a medicine. I'd like to talk about ways that we're not necessarily using medications. Talking about just staying active. And I know that frequently when we talk about exercise, that gets that big sigh, like, oh, that seems exhausting. But what I'd like you to think about is not, I need to go out and exercise. I want you to think about, how do I stay more active? For some people, that may be simply, I'm going to sit up in my chair, or I'm going to walk into the kitchen a few more times throughout the day. I'm going to, get outside for a few moments while it's nice and warm. But it's all about just a little bit more movement throughout the day. And that is very dependent on where you are to begin with. Other areas are diet. And for me, many of my patients come in and they ask about, should you eat chocolate, or can you have sugars or other, fats, and do you need to follow a strict regimen on that? I can say it's the sodium. I tell them, probably not great to eat tons of sugar and tons of fat, but in reality, it's about watching and following a low sodium diet. And that's something to discuss with your specialist. What does that mean for you? Where are areas of improvement? Sometimes we even have nutritionalists that we can refer our patients to so that they get an even more comprehensive understanding of what a low sodium diet would look like. Something that we don't talk about enough is mental health and emotional support. Having a team around you, a care team, friends, family, support groups, all of that is essential to your well-being. So we're going to talk a bit about that. And then the fourth piece is, do you feel like you can contact your healthcare team as soon as you notice a change? One of the things that I always worry about is that many people feel as though it's a bother, or maybe they don't get a response in a timely manner from their healthcare team. For me, if something is changing and I could potentially impact how my patients do, I want to hear from them. Let's talk about exercise. I know I promised I wouldn't talk about it in exercise. We'll talk about it as activity. We know that the research has shown that regular activity can lead to improvements in how you feel. That doesn't mean go out and try to run the marathon. This means recognize what your limitations are right now and try to keep active and listen to what your body is telling you so that you don't put yourself in harm's way. That often means consultation with your physician, but also maybe a recommendation referral to things like cardio or pulmonary rehabilitation, where you have specific physical therapists who are really listening to your needs and providing a detailed exercise or activity regimen for you to be able to follow. Now let's talk about that sodium. What we eat really does matter. I think most of us probably, our mother told us that at some point in our lives. High sodium causes water to follow the sodium, and then that increases our blood volume, and that often increases how hard the heart has to work and causes the pressures to increase, which strains the heart even further. So by following a low sodium diet, we can reduce that volume, reduce the fluid retention that an individual may experience. So some of the ways that I can just highlight a few foods that you might be able to, limit or reduce in your diet would be things that are in bags, boxes, cans. We usually need sodium to be able to preserve them. So that's where really reading those nutritional ingredients can be helpful. Other things that we never think about, but cheeses and condiments like ketchup, and even breads. So just being aware of where sodium may hide. We know that fresh food tends to, be the most low in sodium. So being able to eat fruits and vegetables and meats that are fresh, those often are going to be places that you can feel safe in terms of the amount of sodium that you're intaking. Now let's get to this mind and a spirit. I think that everybody needs somebody to talk to. We all have difficulties in our lives. My patients with PAH have an added stress because they're really thinking about their health and their long-term outcomes. And so we know in PAH that a third of our patients, and I'm sure more than that, but we may not ask the question, suffer from anxiety and depression. It's important to know those signs. It's also important to feel enabled and empowered to talk to your healthcare providers about this. Are you losing interest and pleasure in things that you used to do? Do you feel down or hopeless? Maybe you're sleeping more or you don't sleep enough. Maybe you're feeling excessively tired or that you're eating more or less than you used to. And are you having trouble concentrating? Now, some of those signs that I just described can also be indicators of other diseases. So it's really important to talk about this so that we get a good sense. Is there something else we need to be treating? Or is this sort of the mind, body, spirit that we should be paying attention to? And how might we be able to help? It's key. All of us need things that we look forward to, that we're hopeful for, and that we love. For some, that may be meditation. Maybe that's listening to podcasts or writing in journals or painting or certain hobbies. For others, it's very different. And I just would say take stock in what you enjoy. If there were things that you did at a different time in your life that you might be able to get back, that's what we're looking to make as part of your goal setting and treatment plan. That emotional support helps us to continue to do the things that we love. This is finding relationships that we can count on. Sometimes that's having a therapist where we have space to just say the things that we need to say. Support groups can be fantastic. You don't have to speak. Listen. Or talk about your experience. Often this is a place that you can learn coping mechanisms, but more importantly, you can feel a sense of community because you aren't alone. Some of the ways that you might find a local support group is to ask your specialist, but you can also visit the Pulmonary Hypertension Association website, which can put you in contact with other support groups. Sometimes you may not have a local support group, and it may be important to reach out and join a support group that, even if virtual, would allow you that community so that you feel connected. Let's go ahead and recap these 4 essential elements of your PAH care. First, we talked about seeing a PAH specialist. Their training and specialization and experience is going to be key to creating the right treatment plan for you. Please be open with them about your symptoms and how you're feeling, even if it may be that you disagree with what's being done or what's being said. You are the captain of your ship. We as the providers are helping you to navigate. 2, those regular risk assessments. Our goal is low risk. We have to make a plan, and then we have to adjust based off your needs. 3rd, setting those goals, knowing your options, asking about medications, asking about how they work, making sure that you're saying, do I need more? Are there other additional therapies? Or maybe there are research trials or other opportunities within your community and with your providers. And 4th, self-care and healthy daily habits. Find the activity level that's going to be most beneficial to you. Continue to strive to move more and do more. But also be reflective. Look at the signs for anxiety, depression. Reach out to others. Try not to seclude yourself away. I know that it's at times easy to do because it's hard to face this. But I think that having a community and being part of a community where we can support each other through hard times and good times is essential to our outcomes, not just in PAH, but across the entire spectrum of how we live. I want to give you a few resources to be able to use. So there's some QR codes that are up. They're going to stay up for a little bit so that you have an opportunity to scan it in if you'd like to. Otherwise, you can always visit this broadcast at a later date. But these QR codes are going to either take you to our PAH Initiative website, where you can look at more opportunities to explore risk assessment. You can learn more about prostacyclin and other imbalances in PAH. You may be able to discover more resources for nutrition and exercise. You can even sign up for the initiative yourself. And you might be able to find a way to link to a specialist in PAH if you don't already have one. Some other additional resources are going to be for the APA Mental Health Professional Locator, because we know that they're in short supply. This may provide you an opportunity to find somebody that is either in your area or that could provide for you. And then the PAH Support Group Finder. As we talked earlier, finding your own support group will, I think, long-term help you feel connected. Thank you for joining us on today's broadcast. It is always a pleasure to be able to bring more insights about pulmonary arterial hypertension. But please join our initiative. There's a QR code, and connect with us on social media. My pleasure to be here, and I look forward to next time.